Barrett's esophagus is a precancerous disease affecting the lining of the esophagus and is usually caused by gastroesophageal reflux disease, also known as GERD. GERD is a digestive disease characterized by chronic acid reflux, which occurs when stomach acid flows back into the esophagus. The backwash of stomach acids and enzymes can irritate the esophagus, causing heartburn and other symptoms. For some, this constant irritation over time may cause the cells in the esophagus to change. This is how Barrett's esophagus develops. There are 3 grades of Barrett's esophagus. The first grade is intestinal metaplasia, when normal cells begin to abnormally transform into precancerous tissue without the presence of dysplasia. The second grade is called low-grade dysplasia. Dysplasia occurs when the abnormal cells begin to change in size, shape, or organization. Dysplasia increases a patient's risk of developing cancer. The third and most serious grade is high-grade dysplasia. Cells appear very abnormal and represent a more advanced stage of precancer of the esophagus. If left untreated, Barrett's esophagus may progress to esophageal cancer. Barrett's esophagus is the primary risk factor for the development of esophageal cancer. The lifetime risk of progression for patients with dysplastic Barrett's esophagus, low-grade or high-grade, to esophageal cancer is 25.6%. Patients living with Barrett's esophagus have up to 60 times higher risk of esophageal cancer. Esophageal cancer has a low survival rate. 81% of people with esophageal cancer die within 5 years of diagnosis. Diagnosing and treating Barrett's esophagus early is key. The good news is that Barrett's esophagus can be treated with Barrx Radiofrequency Ablation (RFA) system. RFA treatments can significantly reduce the risk of progression to esophageal cancer. Radiofrequency ablation therapy can result in a relative risk reduction of 94% in progression from confirmed low-grade dysplasia progressing to high-grade dysplasia or esophageal cancer. Similar to an endoscopy, the treatment can be performed in an outpatient setting under moderate sedation. An endoscope is passed through the mouth into the esophagus. A guide wire is inserted through the endoscope, and then the endoscope is removed. The physician inserts the Barrx 360 Express RFA balloon catheter, which inflates to be in contact with the tissue. The electrode surface delivers heat energy to the affected area, removing the Barrett's tissue while preserving healthy tissue. After the affected area is ablated, the physician removes the catheter and proceeds to clear the ablated tissue from the esophagus. The process is then repeated for a second time to assure complete ablation of the affected area. Regular monitoring with endoscopies and biopsies are recommended even after radiofrequency ablation. If any residual Barrett's esophagus tissue is found, your physician will treat again. If you have Barrett's esophagus, you don't have to live with the risk of esophageal cancer. Find a doctor today who specializes in treating Barrett's esophagus with the Barrx Radiofrequency system. Visit learnaboutbarretts.com.